We pay $1,800 a month for a family of 4 to have health insurance. My daughter was recently diagnosed with diabetes, and they are charging us $4,000 on top of our monthly premium. They are charging us $4,000 for the services that she had to literally save her life. On top of that, they would not cover her insulin pen that she needs. She gets half doses of insulin based on her carbs, and for some reason they didn't cover that. Why am I paying you $2,000 a month if you're not going to even cover what she needs? So it's really hard for me to feel sorry for the CEO of United Healthcare, honestly, or his family, knowing that they have screwed people out of literally their lives. They have not covered things that are medically necessary, life-saving measures to keep people alive. It's not like people ask for diabetes. It's not like people ask for cancer. These are things that just happen, and you shouldn't have to die because afford it.
Hi guys, I'm really stressed today. I just went to the grocery store, bought 10 items, and it was $80 already. I literally have $10 left on my account. So a little backstory. I got laid off from my job a month ago. And I've been applying for jobs months before I got laid off. Sent out hundreds of resumes already. Applied to hundreds of jobs on the internet, remote and on-site. Tailored my resume to every position that I applied using ChatGPT. Went to only a few interviews. And still nothing. What's going on with America right now? Like, it's so freaking hard to live here. Like, I'm gonna stay positive. I'm gonna keep applying for jobs. I'm gonna keep showing up. But man, my bills are not going to wait.
You know what I'm upset about today? Healthcare. I have spent the last few years putting off getting some dental work done because my priorities financially have been getting my son's health taken care of and court for the DV case against his father. So all the extra money, even though I'm not struggling, has gone towards my son, his tuition, his genetic testing, all that kind of stuff. I pay $400, more like closer to $500, about $250 per paycheck, for us to have medical, dental, and vision insurance through my job. And I went to the dentist today for a limited appointment because I have 2 broken teeth on the upper left side of my mouth, and one of them is a wisdom tooth. I never got my wisdom teeth taken out because they weren't growing in crooked or anything, so the dentist said it wasn't a priority. And so one of them's a wisdom tooth and the other one is a molar. And guess how much it's supposed to cost me to fix those 2 teeth with dental insurance? I'm going to show you. I am supposed to pay $1,900. He tried to schedule me for tomorrow, and I had to tell them no. Like, first of all, it doesn't work with my schedule, but 2, like, I'm supposed to be able to make a split-second decision on whether or not I can afford right now to pay $1,900 for 2 teeth. And really, it's for 1 tooth, because my wisdom tooth is just getting extracted, which is about $43, which means that the other tooth is all of those costs. Am I supposed to keep suffering with broken teeth? No. So then I do what? I spend this $2,000 on this, when that $2,000 can go towards my kid or other bills. I just, like, what am I supposed to do as a single mom who is literally just, and I make good money, like, I make good money. Anybody else, in any other state other than California, I would be living incredibly. I don't know what to do. It's like I pay for insurance, and that should make it where it's not as expensive.
Wow. When I listen to stories like those, I have to be thankful. I have to stop complaining. Because many Americans and other peoples around the world, but I'm talking about Americans now, they're feeling it hard, very hard. And I have to be just thankful for where I'm at, because some people are working hard, 2 jobs. And as you heard of the last person, she's making good money and she can't pay her medical bills. I was in Washington a few weeks ago, and I went to the grocery store, and let me tell you, things are expensive. Things are very expensive. Yet the mass media don't talk about these things, and the mass media don't show you these things. It's we, the small vloggers, have to show you guys that things are really tough.
How are people affording life right now? How are people tackling this cost of living on the average American salary?
Honey, we winging it. We are winging it over here. We are taking it day by day. Every day is a cliffhanger. You heard of robbing Peter to pay Paul? I've been robbing Peter and Paul to pay Patricia. Real life is real life out here right now. Nothing's easy. People are losing sleep at night, because Lord knows I am. Losing sleep at night, up thinking, you stressing, because not only are you trying to figure out how do I afford to breathe, how do I afford to eat, how do I afford to drive, how do I afford to stay healthy, you're trying to make sure your kids is healthy, you're trying to make sure ain't no more pandemics, epidemics, dirty diseases and disasters coming. If you got animals, hell, they just like kids. You got to make sure they straight. Real life is real life out here. I'm not saying I'm not blessed. I have a support system around me that does, help. I have a 2-person household. Bae has a decent job. I have a decent job. I'm thankful for. We do what we can. We sit down. We discuss things. We budget. We plan out. We time. But that don't make it no less hard. It just makes it semi-tolerable. I can't imagine somebody who out here having to do it alone. I can imagine somebody who out here, you got 4 or 5 kids and you by yourself. The average American is struggling, stressed, tired, trying to keep it together mentally, physically, emotionally. And as a collective people, I do like the fact that we're all acknowledging it. It's not no secret. That's why those companies felt the power on Black Friday. That's why nobody was out. Because for what? We ain't got no money. You got everybody asking about the same thing. Groceries, rent, gas, bills. Real life is on hard mode right now. We've been playing Jumanji since 2020, and it ain't cool.
The average American worker makes around $58,260 a year. The average American CEO will make about that much in less than 7 hours on the first workday of 2023. That is how bad inequality has gotten here in the United States, where CEO pay has really skyrocketed. In fact, it has increased 1,322% from 1978 to 2020. At the same time, wages have been stagnant for American workers, especially beginning in the 1970s. Their productivity has certainly gone up, as you can see from this graph, but their hourly compensation has remained stagnant. Now, the numbers are even more enraging when you break them down, when you break them down by profession, okay? So when you think about all of the essential workers out there, all of the critical professions that help Americans live as comfortably as they can, they are so underpaid compared to what these CEOs are making. So let's take a look at it. Sarah Anderson of inequality.org, put this data together. And here's what we know. It would take the average American CEO less than 3 hours to make more than the average American fast food worker's annual salary of just $26,060 per year. Less than 4 hours to make more than the average American home care aide's annual salary of $29,260 per year. It would take the average American CEO less than 5 hours to make more than the average American pre-K teacher's annual salary of $36,460 a year. Let me give you one more. It would take the average American CEO less than 7 hours to make more than the average American firefighter's annual salary of $55,290 per year. Does that make any sense to you guys? Doesn't make any sense to me. And when you're dealing with an economy that is reliant on consumerism, how are you going to expect things to run smoothly if Americans don't have the disposable income necessary to stimulate the economy?
Wow, people, can you imagine that? Listen to what a CEO makes in minutes and hours compared to our average employee. It's a free market system, but it's highly unfair. It is highly unfair.
We're cutting your taxes. We're going to cut them very substantially. We got them down to 21% from probably 42 or 44%, depending on where you are. And we got them down to 21. Everyone said that was a miracle. Now we're getting them down to 15, but only if you make your product here. Otherwise, you pay 21, which is not bad. And for those that are running the big companies, those great, big, beautiful companies, nobody's going to be leaving us. You're going to be coming back. You're going to be bringing it back to the United States. We are incentivizing everybody to come back to the United States. We're going to have an economy the likes of which nobody's ever seen before, and everybody's coming back to America.
So here's the state of American healthcare today. I'm a cardiologist, and a patient was referred to me for a cardiology procedure because, well, they need the procedure. Now, before we can schedule it, we have to get approval from the insurance company, which often requires a prior authorization. So for that, we submit all the information to the insurance company and await their decision whether it's approved. Of course, as it frequently happens, it was not approved, and they're requesting more information. So we submit more data. Several days later, they come back and say, nope, still not approved. So they are requiring a peer-to-peer, which means that I get on a phone call with a doctor who's employed by the insurance company. So then we have to schedule the peer-to-peer. So my staff gets on the phone, day 1, day 2, day 3, an hour plus on hold each time until they finally get through. And then they schedule a phone call, which is scheduled at the end of the week. They give you the time, and I got to carve out time in my schedule in the middle of the day so I can speak to this doctor. Mind you, this process has now taken almost 2 weeks. And at the end of the day, it's probably still going to be denied.
The American healthcare system is truly doomed. What is the root cause of all this? Well, quite frankly, the forgotten patient. Large hospital corporations and insurance companies continue to function without regard for patient outcomes. Well, is there any hope in this seemingly overwhelming situation? Well, let me tell you how I deal with it. Honestly, one patient encounter at a time. With every family and patient that I take care of, I take care of them as if they're my own. How can you move the needle in a positive direction? Well, at your next doctor's visit, use it as a time to educate yourself, ask questions, become informed. Number 2, research on the internet. Find experts that have opinions about your particular situation. Sadly, most Americans spend more time investigating and researching a refrigerator or a car than they do their own health care. And number 3, accountability. Take responsibility for your own health care. Engage in the process. If you do not engage in the doctor-patient relationship, it's doomed to fail.
I got a $14,000 ER bill for just being there for 3 hours. $14,000. Living in the USA without health insurance is wild, like wild. And I grew up without health insurance and have so many stories about this. But this right here, this particular instance, I had extreme stomach pain. So let's check out these numbers, okay? What costs $14,000? Radiology, $600. Laboratory, $400. Urology, just for them to check your pee, it costs $300. CT body scan, $5,800. Did I ask for a CT scan? No, but my stomach hurts, so they said I had to have one. Ultrasound, $2,000. Emergency room general, so just to visit the emergency room, to just be there, $3,500. What is in that $3,500? What is included in that? Because everything else I did, like lab work, everything, it's additional on here. Diagnostics, lab, so just them doing my lab work, like taking my blood, $1,100. $14,000. Now, lucky for me, I have insurance. So this, for me, went down to $115. I did, however, grow up without insurance, and my parents, they still don't have insurance. So when they are in extreme pain like that, they will literally sit there and suffer until it eventually goes away because they cannot afford to go to the ER and get help, which is so sad. Now, as a mom, this makes me think of what my mom went through. Nowadays, when my kids are sick and they're feeling really, really bad, I am privileged to have insurance and be able to take them to the hospital. But when we were little in the United States, my mother could not afford to take us to the ER when something was really, really scary or bad, you know? She would just have to wait it out because we couldn't afford it. So sad, so many people still live this way, including my own parents. So healthcare really needs to be more affordable. Our taxpayer money is used for awful things in the world, but it cannot be used to get us health insurance so that we don't have to live this way. It's sad.
From super predators, we can't, in the 1990s, we can't forget that. Super predators was his name.
Someone, please tell me how this is fair. I'm trying to get my own health insurance because I'm self-employed. I pay taxes. I do not qualify for my state's health insurance, which is free, New York State. And I'm asking, and they're telling me that monthly, I have to pay more than $8,000 as premium. In what part of the world should this be so? Yet, illegal immigrants, people that broke into this country, came in illegally, get free healthcare in New York State. When the Bible tells me that he that will not work, let him not eat. The Bible tells me that I should pay my taxes. I diligently pay my taxes. I was going to hire somebody to work for me, and guess what she told me? She said no, that if she works for me, she's going to get out of her tax bracket and she doesn't want to pay the taxes. This is what our system is doing, encouraging people not to work and depend on it. This is socialism, and God hates it. God gave us the ability to work, and guess what? I'm not going to be stopped. I'll keep working, I'll keep making more money, but for me, out of my hard-earned money, to have to pay so much to get health insurance, and I'm not getting this health insurance because I fall sick. For the past 3 years and more, I have not visited a doctor. So now I'm going to be paying this $1,000+ monthly and not use it just because I just want to have it there. Because now and then there are things that may happen and you may just need to see a doctor. Things need to change, because there is no reason why you should reward people for making less money and punish people that make more money. This is America's healthcare system. This is what it is. God help us.
Your people, the struggle is real. The struggle is real.
Last year, United Healthcare made $16 billion in profits. $16 billion. And denied almost 9% of all insurance claims. They used AI to create an algorithm for going through these claims. If you don't understand how insurance works, my name's Erin. I'm a physician assistant with a background in family practice. And insurance companies do not want to pay for your health care because they are a for-profit business. And what happens is your provider will decide that a medicine or an imaging study, maybe surgery, maybe a referral, whatever that may be, is going to be beneficial for your care as a patient. That is submitted to the insurance company, and then the insurance company reviews those claims. United Healthcare was using AI for some of these claims. A lot of these insurance companies have people that do not have a medical background following some type of algorithm to determine if a patient should receive that care. So they have to have a certain imaging done first. They have to try a medication first. They have to do physical therapy first, whatever that algorithm may be. And I don't think you need me to tell you that medicine is not black and white and every patient is individual. And while there are standards of care, there are always going to be outliers when it comes to those standards of care. Once your insurance denies the claim, you as a patient can request an appeal, or the provider can request an appeal. About 1% of people are going to request an appeal, and I don't know the reason for that. I don't know if it's because patients don't know that it's an option, so they're not advocating for themselves. I don't know if it's providers that aren't advocating for their patients because it's such a hassle. I don't know the answer, but if you have a denial from your insurance company, you can appeal it. That requires a lot of paperwork from your provider. I'm not saying that they shouldn't be doing it, but it is a hassle. Then, a lot of times, as a part of the appeal process, the provider has to do what's known as a peer-to-peer. So the provider that ordered whatever treatment for you has to meet with another provider or healthcare professional to defend why you need XYZ treatment. So all of these things, in order to get something covered by your insurance, takes away from direct patient care. And that is why patients get frustrated when it comes to only having a certain amount of time with their provider. And it's because the admin work and the paperwork and the insurance work that we have to do outside of a patient visit is astronomical. And because healthcare is a business, the people who own the clinic that you're going to, whatever that specialty is, needs to make money. And they're not going to make money if they're not seeing patients. So providers are expected to do an hour's worth of work for one patient in 15 minutes. And even after going through the entire appeals process, only 1/3 of claims are actually going to be covered, or actually going to be approved. So you do all of this work for nothing.
Did you know that in 2000, about 40% of all bankruptcies in the United States were due to medical bills? In 2024, that number is now 66.5%. If you look at this map above me, you can see that the same percentage for other countries is much lower than the US, including countries like the People's Republic of China, which has over 3 times our population, yet has 0% medical bankruptcies because they have single-payer healthcare. When I was 13 years old, I was riding my bike and I got hit by a car. And I still remember, even at the age of 13, that my fear was not being hurt for being hit by a car when I got hit. My concern was how expensive the ride in the ambulance was going to be. I still remember that today, that there was this ingrained fear of healthcare costs even at such a young age. That was the only time I've really been concerned about my health. There are other people out there with chronic illnesses that they have gotten through no means of their own. Some of them have congenital diseases, some of them have syndromes or disorders, and they have to pay a lot more in healthcare costs than I have to. And some of them aren't able to afford those costs. Some of them become homeless as a result. Essentially, what I'm trying to say is that I have very little sympathy for health insurance companies, and I personally don't believe that they need to exist. There already exists a better system that serves more people who require more healthcare needs, more efficiently and more cost effectively, and that benefits more people as a whole. If that system can exist in another country, it can certainly exist in a country that is richer, more powerful, with more capable healthcare professionals.
We are not a great nation when we have 40 million people living in poverty and in despair. We're not a great nation when we have massive levels of income and wealth inequality, when 87 million people can't afford to go to a doctor today. So to answer your question, I think that as a nation, we have got to focus a great deal of attention on those distressed communities. Often they're African American, often they're Latino, often they are rural white communities. And that means making sure that the kids there get the quality education that they deserve, making sure that we're creating good paying jobs in those communities.
Family, drop your comments. Let me know how you're dealing with it. Let me know how you deal with the high costs of medical and dental bills in America. Thank you for watching this video. Peace out, and I'll see you in the next one.